This video will show both lap 4 and 5 muscular strength and flexibility. Muscular strength will be assessed through a 1-rep max protocol, the push-up assessment, and reps to fatigue. The first to be demonstrated is a push-up assessment, which is a reflection of upper body muscular strength and endurance. Those who don't have the ability to perform a regular push-up may perform a modified push-up. This modification is made by keeping the knees on the floor, legs together, ankles plants are flexed, back straight, hands shoulder width apart, and head up. Individuals who can perform a full push-up will have a similar upper body position, but the knees will be off the ground. The hands should be pointed forward and under the shoulders, back should be straight and head up. Subject should lower himself until the chin touches the floor and extend the elbows completely when coming back up. Subject should exhale as he pushes away from the floor. The maximum number of reps that can be performed consecutively without rest is counted as a score, and test is terminated when the subject strains forcibly or is unable to perform 2 correct reps. Next protocol is a 1-rep max using a flat bench press and leg press. A 1-rep max is the heaviest weight that can be lifted only once using proper technique. A 5 to 10 minute general warm-up consisting of low intensity aerobic exercise should be performed, followed by a specific warm-up of several repetitions with a light load. An initial weight will be determined that is within the subject's perceived capacity. This can be between 50 and 70% of max capacity. If lift or press is completed successfully, resistance can be increased 2.5 to 20 kilograms until the net of the subject cannot complete the lift or press without proper technique or without assistance. 3 to 5 minutes of rest should be taken in between sets. Once a 1-rep max and body weight have been determined, the strength to weight ratio can be calculated to classify the subject's fitness category for strength. This is determined by getting the 1-rep max and dividing it by the body weight. The final protocol is the reps to fatigue method of estimating 1-rep max. Certain populations, including adolescents and elderly, are more prone to injury during the 1-rep max test. Therefore, it is more appropriate to determine 1-rep max by completing reps to fatigue or using some maximal resistance. There is a linear relationship between the number of reps performed with the amount of resistance, where an increase in weight positively correlates with a decrease in repetitions. Typically, 10 reps completed to fatigue indicate 75% of individuals 1-rep max. This is a formula that can be used to calculate the 1-rep max. Flexibility will be assessed by doing 4 different flexibility tests. Prior to beginning the test, a 5-minute aerobic warm-up should be performed. Once a warm-up is completed, the subject will proceed to the first assessment, which is a Canadian trunk forward flexion test. This is going to assess the hamstring and the lower back flexibility. The shoes must be removed and the feet should be placed against the box. Subject will reach forward as far as possible while exhaling, keeping both hands together, not allowing one to go over the other, and holding for 2 seconds. The box will be measured in centimeters. According to the SESM guidelines, since the subject reached 43 inches, subject is classified as excellent. The following assessment is a YMCA sit and reach test. The shoe should be removed and we will place a yardstick on the floor, then place a strip of tape on the 15-inch mark. The feet should also be placed on the tap edge and should be 10 to 12 inches apart. The subject will reach forward as far as possible, keeping both hands together, while exhaling and holding the position for 2 seconds. The subject reached 22 inches, which is classified as well above average. The third test is a chair sit and reach test. This assessment is most appropriate for older populations, which measures hamstring flexibility. The subject will sit on a chair that should be approximately 17 inches in height, keeping one leg flat on the ground ahead at normal alignment, and then extend one leg while keeping the ankles dorsiflexed. Subject will reach as far as possible with both hands and hold for 2 seconds. If the subject reaches farther than the toes, then it is positive. If the subject reaches the toes, then it is 0. And if the subject reaches before the toes, then it is considered negative. Subject will not be classified since this is only appropriate for older population. The last test is the Thomas test. This test is used to assess hip flexor flexibility. The subject lies supine facing up on the floor, both legs straight up, and subject will raise one knee up to the chest while keeping the other leg straight. Flexibility is measured by noticing the distance between the knee and the floor of the leg that is straight. If knee stays the same, then subject is considered flexible. The same procedure will be performed to the opposite leg. All assessments need to be performed twice, and their average will need to be calculated. The only exception is the Thomas test.